Welcome to the Aging Well podcast, where we explore the latest advancements in longevity, health optimization, and well-centered fitness. Today we are joined by Dr. Shai Efrati, author of the book Beyond Normal: How the New Science of Enhanced Medicine Elevates Peak Performance and Repairs Brain Injuries, and a pioneering physician and researcher who is redefining the limits of human potential. As director of the Sagol Center for Hyperbaric Medicine and Research, Dr. Efrati has been at the forefront of enhanced medicine, an innovative approach that goes beyond simply restoring health to a normal state. His groundbreaking work leverages hyperbaric oxygen therapy and molecular biology to enhance cognitive and physical performance, reverse aspects of aging, and improve recovery for patients with conditions like stroke, PTSD, fibromyalgia, and long COVID. In today's episode, we'll dive into the science behind enhanced medicine, discuss its implications for aging and longevity, and explore how individuals, from elite athletes to older adults, can harness these breakthroughs to reach their biological potential and age well. Dr. Efrati, welcome to the Aging Well podcast. Before we begin, let's have you just tell us a little bit about yourself and what inspired your journey into enhanced medicine and hyperbaric research.
So, I'm a physician. I work in Israel. I'm working at Shamir Medical Center. I'm heading the Sagol Center for Hyperbaric Medicine and Research. And I'm also a professor at the Tel Aviv University, the medical school and the neuroscience school. And as everything that happened in life, this one also happens by mistakes. Okay, that's how the real stuff are happening. If you are aiming to something, then it's not a big deal. Yeah, you aim for it. So you had a perspective and you were targeting something. But if a mistake happened, an unexpected thing happened, that's where that's where the new things are happening. You know, I'm the head of the R&D in my medical center, and I'm professor at Tel Aviv University. So I have a lot of PhD students. So they are coming to do their PhD or research from any kind. And when the result that they anticipate that will happen are not happening, as you can imagine, everybody is frustrated. Terrible. What happened? My work is gone, etc., etc. And I have a ceremony when something like that happen. I'm bringing a bottle of champagne. Let's celebrate because now we have really new things on the table that nobody anticipated. So that's how innovation started, and the same happened with everything we are doing with hyperbaric. When I started my after the medical school, I did residency in internal medicine, and then I did nephrology, and I it came from frustration a lot. The concept, first of all, of enhanced medicine. The book that I wrote, the name is Beyond Normal, and where this frustration is coming to, in medicine we are targeting the average, and worse than that, we are targeting the average for age, which is totally terrible. I assume that you will not want to be according to the average of your age. You want to be the best that you can. So if somebody, for example, you are doing cognitive tests, and if somebody is at the average for his age, we will tell him you're okay. But it might be possible that he's just declined 2 or 3 standard deviation from where he was before. But from our perspective, it's okay. You're on the average, so that's okay. I don't have the legitimacy to bring you up. And on the other hand, if somebody is very low, let's say he had a car accident, severe brain injury, cannot speak, cannot communicate, and let's say that with the treatment that we are giving, we can make him move the finger. From somebody from the outside, it will look like, something that is not worth treating for. But for this child or adult, it can be a huge thing because if he can move the finger, he can mark when you need him, when he wants you to scratch his back. He can say yes or no just by moving the finger. So it's also okay. So when we're saying beyond normal, we are targeting both age. And I always say that in what we need to do is set the expectation. Okay, you sit with the client in front of you and you tell him what your biological wish is. Okay, for example, my wish was to have blue eyes. Never happened. Okay, it's a wish that I cannot address. but if you understand the wish and you have a way that you can reach that goal and find a way to do it, then that's a worth target. That's something that you should do. And it doesn't matter if it's way above the average or it's way below the average. If you are setting the expectation and you are understanding that this is the biological wish, just do it. And that's the way, that's what we call enhanced medicine. There are different rules for enhanced medicine, but this is probably the most important one. You are sitting together in the room, understanding what the situation is, what the biological wish is. Okay, it can be that you are elite athletes that want to win a gold medal or want to move the finger, yeah, but you set the expectation. The second rule of enhanced medicine is that, I will give you an example what enhanced medicine mean. If you is that you trigger the body, you trigger a cascade of event in the body that will culminate in the desired goal. And let's take, for example, infection. Okay, you can be infection with bacteria or with virus, and if you are infection with bacteria, I can give you antibacterial medication. Okay, antibiotics. This is classical medicine. You've been infected, you have bacteria, I will treat you with the antibiotic, which is great. However, I can give you a vaccination. And when I'm giving you a vaccination, I'm actually triggering a cascade of events that will culminate in a better function of your immune system against the bacteria. It's not a specific target in a specific enzyme. It's enhancing the biology to be prepared for the insult that you're doing. And I can give you another example. Let's say food, okay? If if you're not eating at all, it's a bad thing. But if you are eating in between and you have a time that you are fasting, you are actually triggering a cascade of events that will culminate in a desired goal, that if that's your biological wish. So the first role in enhanced medicine is set the expectation, understand what the biological wish is, see if you can fulfill it and in what way. The second thing is that you are not targeting a specific enzyme. We can do that, of course. Okay, it doesn't prevent the classical medicine, and I'm practicing that, so we do that. But it's better to enhance a full cascade of event to target a specific thing. The third element that we are using a lot in enhanced medicine is hormesis. You familiar with the phrase hormesis?
No.
I will give you an example. Let's say I'm taking mice or rat in the lab. I will expose them to radiation. An amazing thing will happen. What will happen? They will die. Okay, they will develop cancer and they will die. However, if I'm exposing the rats to a minimal dose, okay, very low dose of radiation, then they will have extended life. They will have longevity. They will live longer. Okay, so at a certain dose, if I'm going from a certain dose and increasing the dose, the mortality will get higher. But when I'm at very, very low doses, the effect is exactly the opposite. Okay, another example, if you will do exercise and you will run all day, your bones will be broken and you will crushed. Okay, however, if you are doing interval training, meaning you train today and you give your body the time to recover, you will perform better in all biologic perspective. If you don't eat at all, amazing thing will happen. You will die, okay? But if you are not eating for a period of time, you're actually triggering a cascade of event that will culminate in a better resilience, okay? That's the cascade of event. So we always prefer in enhanced medicine to trigger a cascade of event in the body instead of targeting a specific enzyme or specific molecule. How does it connected to hyperbaric? Or what we call hyperbaric medicine? What is hyperbaric medicine? I will start with explanation. Hyperbaric medicine means that we are using changes in the environment, which is changes in pressure, in gas concentration, in order to achieve a biological goal. Okay, that's what we are using. For example, in medical school, we've been trained to use the knife. Okay, and we cutting people. That's what we call surgery. We are trained to use chemicals, and this is what we call pharmaceutical. But here we are saying we will play with the environment. And there are different ingredients in hyperbaric medicine. For example, the pressure, okay, where the pressure is the active ingredient. Let's say the bends. A diver is coming up very fast from the water. He has bubbles in his body. You want to shrink the bubbles. You are increasing the pressure, and then the bubble is being shrinked, and then you go back to the normal pressure very, very slowly. And that's the pressure is the primary indication. There are indications where the oxygen is the primary indication. For example, CO intoxication. Somebody inhales CO compete with the oxygen, catch the place, and then you have hypoxia, and we want to compete with the CO, so we are giving a lot of oxygen. How can we give a lot of oxygen? You can increase the concentration, but you can go higher than that. You increase the pressure, you compress more molecules per square. More will go to the lungs, and from the lungs to the rest of the body. So this is the oxygen as an active ingredient. However, today we have a whole new field, and this is what we call regenerative medicine. Okay, and and in order to have regeneration, in order to induce the repair mechanism, in order to repair a tissue, there are several elements that are crucial that we need them. And if we are missing one of them, they will not be repaired. The first one is, of course, oxygen. Okay, if we don't have oxygen, we will die. If I will block the blood flow to the hand, no oxygen supply, the hand will fall. Okay, so this is one element. The other element, we need a trigger that will make the body think that there is a problem, and it needs to activate all the mechanism for repair. Stem cells proliferation, generation of new blood vessels, generation of new neurons, all the repair mechanism. What is the most powerful trigger that we have in our body that induce the repair, that is being sensed by the body, and the body will immediately activate all the repair mechanism? The most powerful trigger that we have is actually hypoxia, is lack of oxygen. Because from evolution perspective, every time we had lack of oxygen, something wrong happened. Okay, you cannot get out very good with lack of oxygen. So we need that trigger. However, if I will take a person, hold his breath, stop his heartbeat, I will have the trigger, but I will need a repair mechanism because this patient will not have oxygen. And we were thinking what the body actually sense. Does the body sense absolute values, or does the body sense the fluctuation? There is no absolute in anything. Everything is relative. I will feel that I'm fortunate or unfortunate, not really based on what I have, based on my neighbor has. Okay. If I have a certain amount and he has more, I will say, oh, I have all of this, but look what's happening there. And if he has less, I will say, wow, I'm very fortunate. Look at my neighbors. Okay. That's why I don't want to change where I live, even though my wife tried to push me. Okay. I'm feeling, oh, we are very good over here. the same happen at the cellular level. So what we are doing is actually tricking the body. We are taking the person into a chamber because we need the chamber in order to control the environment. We are increasing the pressure and the oxygen. The chamber is being compressed with air, not with oxygen, and you get the oxygen by mask. And when we are going to 2 ATA with 100% oxygen, it means that we have increased the blood oxygenation from 100 mercuries to 1600. And then there is a certain trick that we do. We ask the people to take the mask off. And when they are taking the mask off, then the oxygen is declining from very high back to the normal. And by doing that repeatedly, we are misleading the body to think that he is lacking oxygen, even though he have extra oxygen. And by doing that, we are inducing all the things that happen during hypoxia, lack of oxygen, without the hypoxia. This is what we call the hyperoxic-hypoxic paradox. Okay? And then the body activate all the repair mechanism, stem cell, generation of new blood vessel, building up new tissue. That's the trick. That's the trick. Okay? So it's not really hyperbaric treatment. It's actually the hyperoxic-hypoxic paradox. This is a very certain protocol that took us more than 10 years to optimize. Now it sounds very easy, but it took us a lot of time to optimize that and make the fluctuation in the best way that to optimize it to where we are today. It might be possible that a couple of years from today we will even optimize it more. But by doing that, we are inducing the repair mechanism, the regenerative mechanism.
No,
That's the
no, not
trick.
at all.
I think I'm speaking too much, no?
Well, you've skipped over about 20 questions that I had, but yeah, you're not speaking too much. You're just making our job a lot easier. So,
Yeah,
so it sounds like really the term hyperbaric oxygen therapy is a bit of a misnomer.
it's a
And
misnomer. It's a
yeah,
misnomer. And you know what happened today in the US? Especially in the US. It's unbelievable. People are taking the high-end research that we did with the optimization of when to take the mask off, on the pressure, etc., and they buying tubes or sacks with a compressor of air to their home, and I see my name on unbelievable occasion. We are giving a Frati protocol, a Frati protocol. It's not even related. This tube with the compressor who put something inside, this is not what we did. This is not what we investigated. This is not what we found to be effective. Okay, we are living in a fake world, as you all know. Okay, people are buying some crappy stuff. I don't know. And 3 weeks ago, there was a child, age 5, who died in such a tube, okay, because it was blowing up. So it has to be a multi-place, a place that you sit like an airplane, where you have a mask, you can take it on, off. It has to be medically supervised, okay? Our health is too important. We should not play with it. So you're absolutely right. It's misleading to call it hyperbaric treatment. It's the hyperoxic-hypoxic paradox. That's exactly what it is.
and so what makes it so effective is the fact that you are tricking the body into believing that it is hypoxic, so that when you do administer more oxygen, it's going to be able to take
Do
that
people
on.
come out
Yeah,
more?
That's really fascinating.
yeah. And
Do people come? Yeah, do people come out like
more what?
shaky afterwards? Because if
Well,
it, no, not at all. So even
no, no,
though
no,
it's
no, no.
stimulating lack of oxygen, it's
You
not
feel
creating like lactic acid in the muscles or anything to that effect. Oh, okay.
exactly the opposite, okay? Because you don't really lack oxygen, so it's not like exercise, okay?
Mm,
you are gaining the things that you will get in exercise, but without the effort. So you don't feel it. The only thing that you feel is when we are increasing the pressure, you will feel the pressure in the ears, just like diving. But that's what all it is. It doesn't happen also in a single treatment. Okay, it's not that you're going in and out. It's a process. You are increasing the stem cells. Stem cells are going up. You are inducing the repair mechanism. It takes time. Okay. Uh, the core of what we are doing is the brain. I think that what we have between our ears is the most important tissue in our body. Okay, that's how we sense the world.
right.
There is no reality. It's all here between our ears. So we should keep that in a good way. And something like 20 years ago, I had the statement that the brain is a tissue. It sounds obvious, but for most people who are dealing with that, not so much, because we used to speak about the brain in a mystic fashion, cognition, personality, okay, information processing speed, executive, perspective, okay, it's all been related to the brain. But it's a tissue. We are doing CT, MRI, it's high tech technology looking at the brain. But at the end of the day, it's a tissue. And many things that in the past that we were thinking that we don't have in the brain, actually we do. When I was in medical school, I was taught that neurons cannot be regenerated. Okay, surprise, surprise. We have stem cells in the brain, in the hippocampus, in the periventricular area. These stem cells replicate and migrate, and the brain tissue is changing all the time. Okay, the brain that speak with you now was not in medical school. It's a whole new brain. If somebody makes you angry, okay, and you are frustrated with him and you want to get rid of him, wait, come to him, 18 months after, you will have a new brain. There is a chance. Of course, the information is moving, but the brain is changing all the time. We used to think that in the brain we don't have lymphatic system. The lymphatic system, that's the tissue that take the garbage out, because in autopsy we didn't saw the lymph vessels. Surprise, surprise, we call it a lymphatic system. And the brain is working like a sponge. It's being contracted like that, and then it takes the garbage out. And the lymphatic system is active during the deep sleep that we have. That's among other why it's so important to have a good sleep, because if you are not sleeping good, the garbage is being accumulated. And just like the garbage out in the house, it smells, it's not good, it will destroy the environment. Okay, so that's the lymphatic system. And we used to think the immune system doesn't work over there. Surprise, surprise, the glia cells as characteristic and can do many things that the macrophage are doing in different locations. So the main problem was us. And this statement that the brain is a tissue means a lot. And in order to demonstrate that the brain is actually a tissue, and like we are repairing wounds in the leg, we can repair wounds in the brain. We needed to develop a good imaging that we can see the brain as a tissue. And for that, we are doing combination between metabolic imaging and anatomical imaging. We are privileged because we have smart people in our research team, from physics, from math, physician, myself, I'm not so smart. I need to see things in a clear way. And then we can look at the brain. When we started with stroke patient. What's good in stroke? Good. No, it's not good to have a stroke, but good for us as a researcher is that after the stroke, you have several degrees of brain injuries. There is an area that is totally dead, and this area is being replaced with fluids. So we don't have infrastructure on which the stem cells can migrate and repair. So with that area, we cannot help yet. I must say yet, because now my colleague works in the university to take cells from the abdomen and make them
Wow.
neuronal cells. So maybe we can put it as a patch and close the gap and then go on it. We are very good in mice. It will take us time to get to humans. Okay. So after the stroke, you have an area that is totally dead. Currently, we cannot help with that. But usually around this area, or in addition to that area, there is an area that is damaged, but is not fully dead, meaning we have still the infrastructure. And this is where we can help. And most importantly, we can do the imaging. And as we said, we can set the expectation with the client. We can tell him, I think that the hand will move, but not the leg, or vice versa. If you want, take the treatment. If not, not. I can help you with the speaking capabilities, not with the motor, or cognitive and not with the motor, and vice versa. And as we said at the beginning, that's the primary rule in enhanced medicine. Tell me what your biological wish. Let's see if we can accomplish that. And once you are setting up the expectation with the client, you can decide whether you want to go to the treatment, yes or no. Then we moved to traumatic brain injuries, what we call post-concussion. After mechanical injury to the brain, you see the long-term effect. And then we said, okay, what about us? What about us? What about our brain? Okay, and we did probably one of the most comprehensive study done so far on normal aging. We took people 65 years or older, healthy, not diabetic, no stroke, no non-obese, okay, because that's something that you should treat separately. And we randomized them into two groups, the treatment and the control group, and we took them to our protocol. And by inducing the repair mechanism for the first time in humans, in normal healthy, we can see neurogenesis, generation of new neurons in the brain. We can see angiogenesis, generation of new blood vessels in the brain. That's been reflected with a better cognitive function. Not because we were training cognitive, because you change the motor so you can drive faster. Okay, that's what we did. And surprise, surprise, we extended to see other tissues. So something like 10 months ago, we just published an article. We did cardiac MRI, again on normal aging. And we see in the cardiac MRI, we see that the same angiogenesis that we have in the brain happens also in the heart. And that's been reflected by a better physical performance. Okay. The VO2 max, the anaerobic threshold, the amount of exercise that you can generate is extending. We also evaluate that at the cellular level. For the first time in humans, we can see elongation of telomeres. You're familiar what telomeres is, yeah?
Yes.
Okay, the bumpers that we have at the tip of the DNA that's supposed to take the hit on the extent of the DNA. So we see elongation of telomere. The amount of the senescent cell were declining. Senescent cells are the non-replicating cells, okay? The stuck cells that accumulate mutation. They are not being destroyed and not being replicated. They stuck, accumulate mutation. These are the cells that will become cancer. So we can see not that we are slowing aging, and it's not aging well. I call it reverse aging because at least with the measurements that we did, cognitive improving because the biology of the brain is improving, physical performance improving because the biology related to the physical is improving, even sexual function, erection is blood flow, and the same angiogenesis that we have in the brain, the same angiogenesis that we have in the heart, we have it also in the penis. And once you have that, you have a better blood flow, and the erection is better. By the way, a lot of people are coming to get the treatment for the big brain, and the big brain is not between our ears; it's somewhere below. Okay, and and that's what I call reverse aging. It's not slowing. It's actually we can take the biological back in time, and I think that the most important thing, at least for me, is the performance. Okay, we are coming to this world for a journey. As long as we enjoy the view, feel the ear on our hair on our face, it's a great journey. But if you are stuck in the car, the windows are closed, you don't see, you don't feel, I don't want to continue in the journey at that stage. So it's performance. And performance, it's something that we can measure. So everybody has his before and after, and then you can continue monitoring that. I will make a pause. I already spoke too much.
I we talk a lot in this podcast that aging well begins at conception, and we could even talk in terms of before that with epigenetics and so on. But as you were talking about this effect for stroke patients and just declining brain function, my brain, I teach a pathophysiology and exercise class, and of course we talk about cerebral palsy. How young can this treatment be applied? I know you're early in the research, but hypothetically, how young could this be applied? And could it be applied in a situation where somebody was deprived of oxygen, had neural damage during childbirth? Can we potentially reverse some of that damage?
So we wanted to do a study exactly on neonates, okay, that just came out with hypoxia. We didn't got the permission to start with the study because of insurance issues. Okay, the insurance company was not willing to cover this study because, as you know, those children are at high risk for debilitation and long life, and then they want the insurance company don't want the exposure. So we are not doing that at that early stage, but we do treat, and there are studies on cerebral palsy children, not neonates, not babies, okay, but children. And the same hold for them. People who are interested in that can write my name and can write cerebral palsy, and they will read a summarized article. The basics is the same. We are looking at the tissue, just like stroke, okay, but this time it's happened early age. We are looking to see whether is metabolic damage tissue, a tissue that is damaged but not fully necrotic. And if we have it, then we can treat, okay? If we have only necrotic tissue or only atrophy, then unfortunately we cannot treat. So it looks like we are dealing with a lot of diseases, okay, or syndromes, but actually we are only treating a wound, okay, and a certain type of wound. And if we characterize and we see the wound, then we can treat it. If this wound is responsible for cognitive, the cognitive will improve. It's responsible for motor, the motor will improve. But actually we are treating a tissue with a certain specification. That's it. It's very simple. It's not complex. Even though from the outside it looks like you are dealing with a lot of, no, 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 no. It's just a certain type of tissue that happens to be in that place or in that place and reflected with this clinical presentation.
Fascinating. Yeah, this is so much, and this is so cool. And I feel like you're revolutionizing where we used to think medicine was, and you're kind of taking it and you're like, nope, we can go even higher with our studies. And it almost seems that you can make the claim that um, not only to help stroke victims, but also other mental declines like dementia, Alzheimer's, uh, things to that effect. I would even say people with depression or anxiety, maybe PTSD, could even come into your case study. And is that a bold statement to make that claim?
I will give you, I will, yeah, I will give you, you are actually touching the base because, for example, if somebody will have come to me 15 years ago and will tell me that I will deal with PTSD, I will tell him, no way. No way, my friend. I'm dealing with physiology. My wife, she's a social worker. She speaks with people. PTSD, it's healthy. But a long time when we realize what we have in our hands, we started to see a lot of stuff. And with regard to PTSD, unfortunately in Israel, but also in the US, we have a lot of it, especially military related, but not only that. And before going into that, I needed to prove to myself that it might be possible that my concept that is my wife deal and not me, I need to prove it to myself. And in order to do that, we have used a rat model of PTSD. Okay, how do you do PTSD to a rat? You take the rat, you put him in a cage for 1 hour, you don't touch the rat with the urine of a cat. Okay, so he's trapped in the cage with the urine of a cat for 1 hour. And then a couple of months afterwards, what's good in rats is that you can take the brain out. Taking the brain out, I was looking at the microscope, I saw a wound. I said, oh my God, I was totally mistaken. The concept that I have, it's not my wife, it's me, it's a wound. And then we generated two lines of research. One of them is military related PTSD, the other one is civilian related PTSD. To make a long story short, we can see the wounds in the brain with the functional metabolic imaging that we have. And and once we see that, we can repair that. So, for example, in Israel, veterans who are suffering from treatment resistant PTSD, meaning they are not responding to the psychotherapy, they are coming to us. We look at the brain, we see the wounds, we treat the wounds, and done. That's it. Okay. And that's what we are doing. That's with regard to PTSD. So you're absolutely right. People can read our article. That's the standard in Israel. Hopefully, I hope that we can bring it also to the US veterans. The US veterans deserve not less than what we have done, we are doing in Israel. I hope everything in the US move a little bit slower, as you all know, than how it moves in Israel. But hopefully we can make it happen. There was a big story done on us on the last study that we did on PTSD on CBS, so people can log and see. Of course, if they want, they can read the scientific article with related to that. So that's one challenge. With regard to Alzheimer, which is the goal more related to your podcast, is when somebody have full-blown Alzheimer, it's too late. Why? Because when you look at the brain, you already see the atrophy. There is no brain. So it's just like necrosis, but it's atrophy of all the brains. So as we said before, we cannot build something totally new if we don't have the infrastructure. So we have good data on age-related cognitive decline, normal healthy, just like we spoke before, a mild cognitive impairment, which is a bit decline. And now we want to push the limits even further. We are running a study on what we call prodromal Alzheimer. What is prodromal Alzheimer? The people have significant cognitive decline, but they can still sign the informed consent. Okay, it's not totally lost. In the brain, we see a certain amount of atrophy, but not total atrophy. And we are doing amyloid PET of the brain to make sure that there is amyloid on the brain. And then we randomize them into two groups, the treatment and the control group. And the big study is running now after a very good pilot that we did. And we will have to see and wait the result and see result. If even at that point it's not too late, maybe we can rescue at that point. Let's see where the limits are. That's what we are trying to reach now.
Yeah, our perspective on the Aging Well podcast isn't about reactive medicine, but proactive medicine. And it sounds like a lot more what you're talking about is kind of in the bounds of that, we're trying to be proactive, but we're going to address those injuries when they happen and kind of fix them. So are there specific biomarkers or indicators that you use to measure success in reversing aging or enhancing performance?
So first of all, we are measuring everything. Okay, measuring everything. I don't like people telling I feel, I don't know what people think. We measure, okay? So with respect to the brain, we are doing high resolution MRI with DTI. DTI stands for diffuse tomography imaging that we can see the fibers. We are doing the metabolic imaging. Here is your brain before, here is your brain after, no discussion. Cognitive test. This is your memory, information processing speed, executive function, all of this. This is your score before, this is your score after. No, this fully computerized, okay? Numbers, scores, okay, like the engine. This is the power that you have. This is what your engine generates. Physical performance. We are doing maximal pulmonary exercise testing, okay? This is your VO2 max. This is your anaerobic threshold. This is the power that you generate. This is before, this is after. No discussion. This is your telomeres before, this is after. This is the amount of senescence before, this is, again, no discussion. It's clear cut, the before and after. And that's the way to treat it, okay? If you cannot measure, you cannot treat. Once you already crashed, it might be too late. And I always say that after the age of 45, you have to choose whether you are managing health or you are managing disease. Okay? Most people are managing disease, and when they have disease, suddenly they have all the resources in the world, the time, the money. Just take me back, doctor. Just take me back. But invest at least half of this in managing health. Okay? What you will have will be much better. Think about the formula race, okay? Formula car racing driver, okay? He will make a stop at the pit stop, not because he's crashing. He can make another round or two rounds, etc., etc. But he's making the stop now, even though every second counts, because he's professional. So he's managing the health of his car. That's how we supposed to handle ourselves. Make the pit stop. And for example, our treatment is 3 months. Okay, you have to go to 60 session, 60 session, daily session, 5 days per week, in order to induce angiogenesis, generation of neurons, blood vessels. It takes time. And then people say, I don't have the time. And I always ask them, if you would have a stroke or dementia, what would you do? He said, I will sell the house and do everything in order to get the treatment. I said, okay, do it now. Just do it now. That's the perspective. And professionals are making a stop at the pit stop, investing in themselves, managing health. It's to manage health. It's not just a statement. You have to really manage it.
So, how does the enhanced medicine address biological aging at a molecular level?
So as I said, at the molecular level, what you are doing with the fluctuation, you are inducing HIF. HIF stands for hypoxic induced factor. It's a promoter that once it's going up, there will be a full cascade of events that will be addressed. The stem cells will proliferate. VEGF, vascular endothelial growth factor, will be induced, and then you will have new blood vessels. Mitochondria are being proliferated and migrated. Okay, mitochondria.
Right.
This is the engine generator that we have within ourselves, and we know today that the mitochondria can actually proliferate, can replicate, and can migrate. Okay, there is a professor at the University of Florida, Caesar. He saw the studies that we are doing, and he did an amazing study. He took cell cultures of glia cells and neuronal cell, co-culture, put them together, and took the exact protocol that we are doing, going to 2 atmospheres and going down. And he was able to demonstrate mitochondrial migration from the glia cells into the neuronal cell. And once the neuronal cells receive the mitochondria, they become more
Oh,
resilient to the different
yeah.
insult that he put on. It's unbelievable. That's it's amazing how much we find that there are new stuff. Okay, every time we think that we know everything, but then we have a new resolution of our ability to see, and then we see a new world that we didn't thought that it is existing. Okay, telomeres are elongating, senescent cells are going down, so you actually address the core. But we must we must remember that our functionality is actually the balance between degeneration, things that takes us down, to regeneration, things that takes us up. So with the hyperoxic-hypoxic paradox, we are inducing the things that takes us up, but we should eliminate as much as possible the things that takes us down. Okay. So if, for example, somebody is smoking, I will tell him you have to stop smoking. And then he said, no, 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 I cannot stop smoking. I said, okay, so go. I will not treat you. Okay. The same goes with the rest of the stuff. Okay. The everything that is our control that takes us down, we should eliminate that. And then you can induce the repair, and then the balance will go into better performance.
So I'm hearing that the age-related decline isn't inevitable, that your research is actually challenging that assumption. Is that correct?
Not only that research, we as human beings are challenging that. You know that in life we have three big periods of life. There is childhood, and the balance in childhood between degeneration to regeneration, it's toward regeneration. Everything is growing, everything is building up. You have a wounds immediately repair, etc., etc. And then we have the reproductive period. Okay, the time period where we are bringing the next generation to that world. So we have stem cells a bit more. The blood vessels are potent a bit less. Okay, so the net effect is balance. And then we are coming to the post-reproductive period. And in nature, and we are one of the species in nature, if you look at all species in nature, after the reproductive period, all the animals are either being killed, okay, or eaten, or dead or eaten. Okay, why? Because if you are not bringing the next generation, you are disposable. You are taking resources from the surrounding, but you're not bringing anything. We, and when I'm saying we, I mean Homo sapiens, humans. We are the only species who continue to live a significant period of time after the reproductive period. And there is a major question: why? Why we continue to live such a long, and we became the ruler of this world, so it means that it has some advantage by doing that. Otherwise we wouldn't have done it, okay, from evolution perspective. And the reason is probably that the knowledge and the life experience that we gain in long life has a lot of meaning to the young generation. And if there is a tribe in the jungle and they are facing a storm, a big storm, what they will do? They don't know what to do. What they will do? They will go to the oldest and ask them, what should we do? And then the oldest will tell them, 15 years ago we had this, and this, and we did that. It didn't succeed. Do something else. Well, that's what's successful. Do that. And that's the meaning of the knowledge that we gain in long life to the young individual. So we are challenging that. Okay. And you said about the mental status as probably the most important thing for aging well. You're absolutely right. When people ask me what is the one most important thing that people should do in order to keep their performance in a good way, they expect me to say, eat that, do that, go to the chamber. I'm saying no. You must be needable. Okay, you must have to look forward. And when people ask me what is an old man, my definition is old man is somebody who looks backward. If you will speak to an old guy, he will always tell you, I used to do that. I used to do that. Before that, I used to do that. And then I did that. If you are speaking to a young guy, he will always tell you, I'm intending on doing that. After I will do that, I will do that. And that's affect your biology because you are not disposable. You have a meaning. Okay, so you must have a goal, and it doesn't have to be world peace. Okay, it's not have to be I'm going to the moon. You have to be needable. And when people ask me, how do I know that I'm needable? I tell them, if there is a day that you are staying at home and not going out, if nobody calls you to ask you where you are, we are waiting for you, then you are not needable. You are disposable. And if you are disposable, I cannot help you. It doesn't matter what I will do from biology. But if you are needable, no problem. We will fix the biology. This is easy. But you have to be needable. Needable for something, okay? Something, okay? For playing cards, for some kind of donation that you give to the society, teaching, playing with, associate with. That's the most important thing. That's the crucial element. It's a crucial element. And when people don't have it, I'm not treating them. I said, okay, go. You need to do work before. Come back to me, one page. What is your future? What you are aiming to? If I will like it, then we will do it. If not, you will have to fix it again. That's that's how important it is. The biology is easy, that's me. But the needable, it's not me, that's you. You have to handle
So,
that.
can the average person incorporate aspects of enhanced medicine into their daily routine without access to specialized treatment? To how would they do
Absolutely,
that?
absolutely. And it's all been. I will start. We just spoke about the mental state. Okay, you can incorporate that very easily, and you can test that. Stay at home, see if somebody calls and tell you I need you. Okay, that's one thing. With regard to inducing your body to repair, okay, do exercise, destroy, and then induce the body to repair. You don't you don't need anything special for that. You need your own, but you need to have discipline. Okay, intermittent fasting and things like that. This is basics. Okay, this is for the general athlete. Let's call it that way. Okay. Now the professional who wants to get to the next level can use the next layer, which is us. But the basic, it's approachable by everybody. By everybody. You just need to decide that that's what you want to do. And in the book, it's all been written, all the perspective. Okay, so people can read it. It's not a book about hyperbaric. It's a book about how we are induced, how we practice enhanced medicine. Unfortunately, I'm professor at the medical school in Tel Aviv University. Uh, so even me, I'm quite frustrated from the way we are teaching today. Okay, it's quite mechanical, and I try to teach in a different way, but still, the main problem, I always tell my colleagues, the professor at the university, the main problem is us. Okay, if you are going if you are going to a physician and he tells you you have to quit smoking because your lungs are a disaster, and then he smokes. So really, you are going to a physician who tells you, you need to do some exercise or diet, but you look at him and you said, really? Okay, really. So unfortunately, we are selecting the students to medical school mostly by the score that they had in high school. Okay, and and medicine is more than that. I always said, practice what you preach. Okay, if you are not practicing what you preach, then don't preach. Find another thing to do, but don't preach. Okay, you have to practice what you preach. So, for example, in my team, if I will find that somebody is smoking, he will lose his job. By the way, I had the problem with that in the US. We have an affiliated clinic in Florida, the Aviv Clinic. It's near Orlando. It's a big clinic that practice the enhanced medicine, and they are replicating what we are doing with Israel. And I told, when they are recruited the team for the Aviv Clinic for the education program that we did to them, I said, you have to ask anyone who apply whether he's smoking, yes or not. And he said, we cannot do that. It's not legal. I said, what do you mean not legal? Don't ask, I will ask, and then I will let him go home. Because I'm from Israel, I'm speaking direct. But that's the way to do it. That's the way to do it. And people are looking at you, they're seeing you, and they will follow or not follow based not based only on the words that coming from your mouth, based of seeing you as an example of how it should look like.
That's been my challenge as a professor in exercise science. As I teach exercise physiology and pathophysiology and exercise, I'm always presenting to my students. It's like, okay, here we have the normative data that, I'm supposed to teach you that, if I can bench press my weight at 20, I'm average condition. But I'm 60, I'm going to be 62 in April. If I can bench my body weight now, which I can, I'm superhuman. And I said, that's ridiculous. We shouldn't be like that. We need to be looking at optimal performances no matter what our age. And repeatedly, I'm coming across that, we're telling people that, they're going to decline, they're going to do this, and it's normal. And it's like, we shouldn't be normal. If I'm standing up in front of you and I'm not in good shape, why do I have a podcast called the Aging Well Podcast? Why am I teaching exercise science? And you've worked with elite athletes and executives. What kind of physical and mental performance gains have they achieved?
So again, we have from all extremities, okay, from judo to car racing, okay, to golf, okay. So you have all the scale. What's unique in elite performance, and it doesn't matter if you are currently going for an Olympic medal or whether you are a CEO or you are an engineer or you are a physician who wants to be the best in the field, it doesn't matter what. The main issue is discipline. Okay? You are not just mangling around, okay? You make a decision, you make a program, you follow the program, and follow the program, okay? You are not going out of the route that you decided. So if you are an elite athlete and you need to run faster, you will invest in that. If you are a judo and you need the information processing speed to work faster, you will invest in that. People don't realize that, but gymnastic and judo, it's brain, it's not the muscle. Everybody is strong when they are going into competition. However, the information processing speed, your ability to think faster, millisecond ahead of the one who stand in front of you, that will make you number one and not 100. Okay. Uh, and if you are a CEO who wants to have a better executive function, a better mentality, that's also a way to move forward. You need to practice that. You need to train that. And at the beginning, we were thinking that the people that will come to our, let's say, enhanced aging program will be people who retired, okay, people who have the time. And you know what? Interesting. It's. I don't want to say the opposite because they are coming, but most of the people who are willing to invest, especially the time, okay, taking a gap in order to do the program, are people that are fully active, okay? They still work, people age 55 or older who wants to stay in the game, okay? They don't want to be on the side. They want to continue with the game. They want to be at the tip. They want to have their brain function because they are responsible for people. They want to perform. They want to be, you need the brain, okay? People who wants to continue with enjoying sex, okay, which is highly important if you will ask me, okay. So those are people who are willing to invest, and the most busy people are the one who are making the effort to give the time for such a program because they want to stay in the game, and they professionals, so they are making the stop at the pit stop in order to continue with the race. And that's a perspective. And I had an interview a couple of weeks ago, and I was asked where the world is going. And the person who asked me this question was aiming for me to say, wow, it's an amazing work. We can take the biology back in time. We can eliminate disease and things like that. And I told him, it's terrifying where the world is going, because on the one hand, you have the professional who are taking the high-end science that we generate and actually practice it and invest in it. However, on the other hand, you can see the average, let's say American or Israeli, who is morbid obese at the age of 50, he has diabetic, he had a stroke, he has limitation, his cognitive is going down. And then you have actually two species that you generate. You have the professional who are at the age of 60 and above are still functioning, who have huge life experience and knowledge that they gain along their life together with a good biological function. This is an amazing machine. And on the other hand, you have the people who are totally lost. This is a complete. These are two species. It's not the same species. And that's where the world is going to. You have two kind of humans, and this is terrifying. This is terrifying because that will reflect not only them, that will reflect their children and the generation that they brought to this world. People come asking me, do you want, so what is your goal? To be 20 again? I said, no, 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 I don't want to be 20. I was stupid, young person without knowledge, without life. The things that I did at the age of 20, I don't want to be 20. No way, no way. I don't want to lose what I have now. Okay. I love where I am now. And the biology, I will build it up. That's it. I'm 55 now. And I don't want to be 20. I don't want to lose everything that I did. Think about you at the age of 20. Maybe you were smart. I
Yes.
was I was stupid.
Was a moron. My goal is to live to 120, and I plan on in my 80s becoming an elite athlete because I was kind of average athlete all through my 20s and everything. But if I just persist where I'm at right now into my 80s, I'll be kicking butt. I could pick my sport and be, a senior Olympian. It's just a matter of maintaining because everybody else, like you said, is going downhill.
There is Dr. Joe Maroon. Dr. Joe Maroon is a neurosurgeon, one of the best in the US. He's dealing with concussions and injuries of sport, NFL players, etc., etc. He's amazing. He's amazing, amazing, amazing. When we started, as I told you, that the brain is a tissue and we can regenerate and things like that, he used to tell me, Shai, it's impossible, etc., etc. And after the ongoing research and the data that we brought out, he realized that it's actually true. So he came to the clinic, the Aviv clinic in Florida, and wanted to test it on himself. He came to do the program on himself. And in addition to the test that we are doing, he have done all the tests separately at outside lab just to make sure that indeed that's what happened to him. And at the end of the treatment, he told me that this is the most expensive treatment he ever had. I asked him why. He said, because now I bought a house next to the clinic because I'm not, I need to be here. Okay. And and
Well,
he's 82.
Oh.
And at the end of the program, he have broke his triathlon record by half an hour. By half an hour. Now think about him, Dr. Joe Maroon. Think about the unbelievable life experience and knowledge that he had. He used to tell me, he's telling me all the time, you don't understand what happened when I started. We used to do frontal lobectomy, meaning taking part of the brain out for people with psychiatric disorder. He said, you won't believe how stupid we were. I did it. He said, I did it. I did that. Unbelievable. And look where we are now. So think about Joe Maroon, all his life experience, where he is now. He doesn't need to feed the kids anymore. So he had the resilience, not with regard to mental resilience and knowledge and data. And he broke his triathlon score by half an hour now at the age of 82. And think about a young student that just finished medical school who needs to compete with him. This is an unfair race. He will never beat him. So that's what I'm saying. That's a new species. And think about the obese, diabetic, couch potato with all the cardiovascular mortality at the age of 50, and think about Joe. It's not fair, okay? But it's in our hands. So again, like we said, if we need to summarize, manage health. But managing health is actually managing it. Practice, invest in it. There is nothing more important than that.
so what are some common misconceptions about hyperbaric oxygen therapy in enhanced medicine that you'd like to clear up?
I think that the most important thing about, by the way, hyperbaric medicine is only part of enhanced medicine. It's not enhanced medicine. It's a tool that you can use, changes in environment to achieve a biological goal. The main problem with enhanced medicine, it's usually people don't know what it is. So if they write it, they will get to things that we wrote or other like us wrote. So it's still okay. The main problem with hyperbaric is the crap that is going around. A lot of frog going around, tubes, sacks, all of that. It's not it. It's not it. That's not the real stuff. If you want to do it, you should do it right in appropriate center with appropriate professional who have the quality assurance that actually what you get in the chamber is indeed oxygen and the compressor didn't put CO or oils or other stuff inside, that the pressure is well controlled. Not everybody can go into chamber. So you need a physician who specializes in that to make sure that you're in to set the right protocol. But unfortunately, today people just write hyperbaric and they see the tube, they see that, and they can order from China, from whatever. That's the main problem with the hyperbaric. So that's the misconception. That's the misconception. That's one of the reason I'm speaking with you guys, because I want people to realize, don't play around with your health. It's too important. If you want to do something, do it right. Do it right with the right quality assurance.
So, if enhanced medicine were to become more widely adopted, how do you think it would reshape healthcare as we know it?
First of all, you will have a physician that spends time with you and understand you and set the expectation with you, not just writing a pill. Okay. For example, you will come with a high glucose level. It's easier to give you a prescription to a pill than to have a discussion with you what you should eat or not eat. So the system at the moment is not built for that. That's why it's been done mostly in a private way. Because if you're working in a commercial medical facility, you have few minutes per clients, and in these few minutes, you need to speak. You need to write in the computer. You need to prescribe, and you need to bill. This is impossible. Okay. So, for example, in the clinics that practice enhanced medicine, if a client is coming to your room, you will have an hour to spend with him to understand better, to go through everything in deepest way. And if you finish before, okay, so you have time for a coffee. It's not a bad thing. You need to recover between people. So currently it's being done mostly private, again, because the commercial way or the general medicine in the US or in the Western society, it doesn't give the time for the physician. It starts with it also goes with physician education, okay, to feel comfortable. I'm from Israel, okay, so when I started teaching the physician and the medical team in Florida, in the US, you are going in front of a guy and you ask him, how do you feel today? It's not a real question. So when I'm going in, people ask me, how do you feel today? I stop. I tell them, it's great that you ask. Now that you ask, I have to share with you. I had a terrible night, and then they look at you terrified. What? What do you mean? Why do you share? Okay, so it starts with education, that the words that coming from your mouth should be meaningful. You should mean it. Don't don't say something unless you mean it. If you ask somebody, how are you, you have to ask him, how are you, and stop, wait. Okay. And when I'm asking somebody in the US, how are you, I said, I mean it. I want to know, how are you? Okay, really know. Okay. Otherwise, don't ask. Say hi. That's enough. You don't just say the word. So it's how you communicate, and you need to shut your mouth down. Let people express themselves. Don't do a check line. I ask this, I ask this, I ask this. No, let people speak. Just listen. The person can take you into places that you never thought that you will be. Okay, so it's how you practice, how you do, in addition to other things that also we don't teach. Okay, in medical school today, I teach, but it's not the classical. That's me. Okay, but and then the way you practice. I hope it will get get to a point that more population, it will be reachable for by them, because today it's only in the private section.
So, what's your ultimate vision for the future of aging in medicine?
I think that it's two things. Yeah, but let's speak about aging because we're speaking about aging. I think that the goal is to generate an Alzheimer-free community. Okay, that's the number one goal, and and it's something that can be done. It's something that can be done, but you need to start early. When somebody have Alzheimer, actually the process usually start 20, 25 years before, and and we need and we need to address it appropriately. It's not the amyloid. Today we understand that the amyloid, it's not the primary cause. It's not good to have amyloid in the brain, but it's not the cause. How do we know that? Because we have drugs, medication that can take the amyloid out. So we are taking the amyloid out, but the clinical doesn't is not being affected significant. Okay, even neglectable. So the amyloid is a reflection of a process that happened in your brain. So I think that the goal is have an Alzheimer-free community. How do you reach that? You start early. You monitor things objectively. Cognitive, it's not that I feel, I forget. This is your memory. Do a computerized test. I will give you an example. People are doing colonoscopy. People are doing annual checkup. Have you heard of any annual checkup that includes the brain? Nobody is doing that. Okay. And this is the most important organ that we have. But nobody evaluates his brain. So I tell people, even if you are not going into, for example, the Aviv program, just evaluate your brain. Evaluate it this year, do the MRI, high resolution, do cognitive tests, and reevaluate the year after. If you will see a decline, your motivation will be dramatically changed on what you're doing. If it's stable, great. It means that what you're doing is good enough. But evaluate the brain health. Just evaluate. Just evaluate. Just look at it. You're doing blood tests, you're doing colonoscopy. That's the most important thing. So we speak a lot, but we do nothing. Okay? We do nothing. Evaluate, evaluate, evaluate. Be active. More than that, we are living in a period where the data is accessible to most person. Okay? You don't need the physician to tell you everything. You can consult with the physician, but you actually have access to the data. Be proactive, see what can be done, think, and then consult. And when you are consulting, the doctor is not God. He can tell you his opinion, okay, based on the knowledge that he have, but he might miss something. You can consult more than one, but take control of your health, full control of your health. Decide what is most important for you and follow it and monitor objectively everything.
So, speaking of, what are you doing personally to age well?
So, the most important thing, I always think about the future. I always have new studies, new things that we're doing. This is one. I don't eat crap. I always said, don't eat something that your grandmother didn't had in her kitchen. Okay, this is the most important thing. Trying to avoid carbs as much as possible. Okay, for example, if I'm eating, I will not eat bread, okay, or chips or fried. I will take another meat, another chicken, another fish, but I will not eat the bread, okay? Vegetables, a lot. I'm in the Mediterranean, so the vegetables are fresh, okay? So there are places that it's hard to find fresh vegetables in the US. Unfortunately, I once I was looking all over the town to look for tomatoes and cucumbers that looks good. So vegetables free, olive oil free, carbs out. And I'm doing 16-8. I live 68, meaning 16 hours I'm not eating and 8 hours I'm eating, but you don't have to eat all the 8 hours, meaning you have to have period of time that you're not eating. That's the important thing. Okay. that's not for losing weight. That's for autophagy. Autophagy, auto is self, phagy is eating. There is a Nobel Prize on it. When we are not eating for more than 12 hours, actually the cells utilize the garbage accumulated to generate energy. Okay, so you're actually taking the garbage out and utilize the garbage. So that's another thing. And I'm doing exercise. I'm doing jogging, doing something like in between 6 to 8 miles 4 times per week. That's me.
Of course.
And hyperbaric, of course. Every two to
Of
three years,
course.
yeah, yeah. Every 2 to 3 years, I'm doing a full course.
How can
Yeah.
our listeners and viewers connect with you and learn more about your work? Is there a website, social media, but more importantly, where can they find your book Beyond Normal?
Very easy in Amazon, or you just write in Google Beyond Normal and Efrati, so you will see it not in only in Amazon, also in other, because I don't have percentage in Amazon, so you can buy it anywhere, but you can download it in the internet, listen to it, read it, or order the book itself, whatever you choose, and the book has all the elements that we just discussed. In the US, the most advanced clinic that practice enhanced medicine, that's the Aviv clinic. It's actually Aviv. Aviv, it's a network of clinics that works, and they have everything needed for evaluation. Okay, evaluation of the brain, of the cognitive, physical, all the things that we said, you can be evaluated, DNA, whatever can be evaluated. And I would so it's the largest clinic in the US is located in Florida, near Orlando. And people can just write Aviv Clinic and go there. I will highly recommend, even if you are not doing the program, do the evaluation. Okay, at least for the brain. Okay, at least that. Okay, see where you are. Uh, and we have a clinic in Israel, in Dubai, in other locations, but that's what it is. Today it's very easy. You just write the name Beyond Normal in the internet of the book, and you can read it and learn more.
And we'll put a link to the Amazon site where they can get the book and your web page and everything else. But this has just been extraordinary. I've enjoyed this conversation. I've learned a lot. Um, we on this podcast, I think, are big promoters of what you would label as enhanced medicine, optimizing medicine, whatever you would call it, living a life that is going to allow us to, as we say, age well. And so we appreciate the work that you're doing. I'm looking forward to reading the book. I haven't had the opportunity yet. We kind of booked this conversation. Well, I have a whole stack of books I got to read. So I will be diving into that here soon. But I want to thank you for your time, and just keep doing what you're doing and keep aging well. Thank you for listening. I hope you benefited from today's podcast. And until next time, keep aging well.